Good afternoon, everyone, and thank you for attending today's webinar, I've Got Your Back, How to Support Your Front Desk and Maximize Revenue Cycle Performance, presented by Susan Childs of Evolution Healthcare Consulting. Please be aware that there will be a question and answer portion today at the end of the webinar. To avoid frequent interruptions during the webinar, please type your questions in the question box located on the right of your screen. They will be answered in the order received during the question and answer portion. Additionally, an electronic version of this presentation will be emailed to all participants following the completion of today's webinar, and a recorded version will also be available on the website for members only. Again, we would like to thank you for attending, and I will now turn things over to Susan.
Hello, and thank you, Bria, so much, and thank you guys for having me. This is one of my favorite topics because I will always support the front desk. I think they are at the brunt of it, certainly at the front lines, and we'll talk a lot about that. And I have a feeling that a lot of you that are attending have also worked the front desk, and that's why you can maybe appreciate it a little bit more. And if not, hopefully this will make you feel a little bit better and give a little more insight to what their daily life is like. So assuming a lot of us have worked at the front desk, I will never forget my first day when I worked at my first medical practice, and I walked in to Orange Family Medical Group in North Carolina, and I was met by Elaine Sizemore, who looked up from the front desk and smiled and looked at me and said, "Checking in?" And she made me feel so good about being there. And I was not a patient. And I told her, no, I was there and she was there. And I was there for her to train me on my first day. And she trained me so well. And the one thing that she held most important was greeting every patient with a smile, because she knows a lot of people when they come in just aren't feeling well. And that's something that we have to remember. And that's hard for the front desk to deal with. So impressions are truly, truly made in seconds. I think it's 10 or 12 seconds that the first impression is made, and she made the best impression possible. And we know what that's like and what matters the most, and we're a patient walking in the door. This is the highest burnout position in the practice. The others are non-physician providers and administrative staff, which is us, right? So let's get started. You know that your front desk is your front line, and we're going to be looking at all aspects and duties of your front desk. And this is where your collections start. Your time of service payments at reception have a clear and direct impact on your revenue cycle, right? 96% of your patients have an expectation walking in the door, and that is based upon what they have previously experienced, whether in your office or someone else's. And we'll talk about that, about what they expect as they walk in your door, and especially from your receptionist. The front desk affects every nuance of your revenue cycle, from entering the demographic information and doing it correctly to collecting the appropriate amount of money respectfully and nicely according to the patient's planning coverage. And do I need to talk about prior balances and collections, having to deal with that sometimes? Think about your billing department. We'll discuss them as well, and the relationship between them and the front desk, which should be totally intertwined. And something we all love to talk about, which is the interdepartmental relationships, which can be fun and challenging, but they can also be very, very good. We'll talk about your role, because it always comes back to this, the one of the leader. You're the one in charge, you're the big cheese, and you can be the most effective leader possible. And what that means to the overall performance of your employees, and how is the setting for the example of expectations? How do you set that example for loyalty and patient care? With a practice, I found that common goals and the common grounds and goals are key. And if we want the same thing, it shows and it bonds us all together. It really does. And patients see that. This is the golden egg, because this could be your front desk. Think of this as you hear the stories and how people in your practice are working, and how anything you hear me say or you discuss in your practice applies directly to your staff members and your population. No one knows your practice better than you. I can come in as a guest to people's practices, and I love it, but you know the patients and practice better than anybody else. And take that knowledge and let it work for you. There's a lot of in-between-the-lines stuff that you don't even think about. And customer service is a huge part of that between-the-lines knowledge. And collections are very specific to your patient base. So consider any questions you may have for afterwards as it pertains to your particular practice and patients. And as we know, some locations, patients are more willing to pay than others as they walk in the door, and some feel like you have to practically lock the door before they leave to get any payment from them at all. And again, we know the population. So hopefully we're going to be offering different approaches that you can fine-tune and make your own with your particular group. I think this is really important, your first impression, especially as a receptionist. This is a sign that I took a very quick picture of. I worked with this practice for a very short time because the physicians did not want to give an inch, and I really felt badly for the employees. Really nice people, just different priorities. But this sign, think about the first impression the patients see. So this is how important this is. This sign actually says, very badly placed and misspelled are the following messages. Payment expected at check-in, sign up for patient portal, appointments not canceled will incur a fee. The word incur is missing the I. There's no welcome, there's no please, no thank you to be seen. And worst of all, why would there be a message about no-shows in front of a patient that is showing for their appointment? Think about that. I'm a patient who's made a real effort to be there on time, and I'm being chastised for something I didn't even do before I even check in. That is not good. They don't need to see that. Timing and placement is everything. We all have to feel the value when we're paying money for services. I know I do. And they're not going to offer money. I won't until I feel I've had that service and what I consider perceived value for the money I'm paying. And you may have already established that walking in the door. A good example of that with customer service and the front desk greeting you is that they have fit you in when they really didn't have a spot, but they knew you really needed to be seen. So that comes across even before you walk in the door at times. We all need to be affirmed, every one of us. I have a friend who's a therapist, and affirmation is a big part of her vocabulary, right? But we know that receptionists are not happy a lot of times. I know I don't like going nowhere fast. I like to get things done. And one time I had a receptionist come up to me and say, I don't feel like I'm getting anything done. I feel like I'm the hamster in the wheel, and that's truly how they feel. So I reminded her that every time she enters the information correctly for from their insurance card, the claim gets paid the first time, and it's beautiful. When she sets the schedule correctly, or she's polite to a patient, or she's made a patient feel better, or she's collected just the right amount of money, she has done her job. That helps us. They set the pace for the entire schedule. And then there's all the collecting of money. You can see why we have to keep affirming their role in the flow. And each patient literally begins and ends with the front desk, and we should respect that. The patient expectations are very different, and the comfort level that makes them desirable to pay your bill. So what do they see when they're walking in your door and online? The level of technology and expertise presented is what they really expect. However your front desk looks is also how they anticipate their care will be. So go to your front desk and look at it. One thing I do with every office I work with is I have the front desk come out into the lobby and look into the front desk as a patient sees it. And they see things totally differently because the front desk doesn't work in the lobby. And I remember one place in Texas I was working, the person said immediately, oh, I have to close that closet door. She never even noticed that she left it open, let alone curtains showing machinery, things that are visible that shouldn't be seen. So if they walk in the door and they see a nice, clean, welcoming front desk, that's the first image. That's what they think that their payment and their payment's going to go towards and what their care is going to be like. And online as well, what would you say to someone in your doorway? That's what the patient sees. Someone I once said, her name is Maureen from Indiana, and she once said to me, as premiums rise, so does the level of the patient's expectation. And a patient expects compassion more than anything else, and the front desk is the first one to deliver that with every employee and every patient encounter. Think of the front desk, the labs, the nurses, when they're not in the room with you, to actually be available and have people be able to listen to the calls and listen in, such as a ghost patient. Having a ghost patient can actually be enlightening. When the employees are aware that you're not in the area, they may say things or do things when you're not around. A ghost patient sees everything, and that's good and bad. One ghost patient visit I had, it was the best visit I've ever had. It was amazing, and it was great to be able to use that in the training. Ghost patients see a lot of things that you don't see. You can also have patient panels enter things as well and use these observations for training tools, both good and bad examples. There are also companies that will record your phone calls. You can use those for training purposes as well. I use that with a dermatology practice where the front desk receptionist could have taught a class. She was amazing when she spoke with the patient. And that, again, affirms their value and their contribution towards the entire practice and meets the patient's expectations. And then on the flip side, who gets blamed? There's a saying, you're working on my last nerve, and that's kind of like the way this rope is, right? Who gets all the guff? The front desk gets all the guff. If the nurse is backed up, if the billing staff is at lunch and you're trying to get someone to help with a bill, if the OSHA inspector shows up, if the doctor has too many no-shows, and they get to ask for money all during this as well. We really have to be the person who greets the patients, takes the money respectfully, deals with all the complaints, because we are truly the front end. And you can see why it's so much easier and so much smoother if they know exactly what's expected of that, because they have the octopus syndrome. They are handling all of these requests while greeting patients. And it's okay to multitask, but a lot of people say now multitasking is not as good and to focus on a few things, but the front desk is really not designed that way. We can make some really good changes, and we can talk about that as well. But initially, the front desk always gets blamed for anything that's going wrong because they are the accessible staff member to the patient that's waiting. It just makes sense. So make it easier to respond. And this is where scripting can alleviate some of the frequently asked questions, like, why is Dr. Brown so late all the time? And if you get that question all the time, maybe you can have a standard answer. Directions also are very important. The front desk is also the person the most to give directions from any practice. So make sure you give it to patients in a way they will understand, not in a way that locals know it, because a lot of people are brand new. So think about that. Look at this woman. Would you not want to look into her eyes all day? She's absolutely stunning. And I have a saying up here, we don't pay our receptionists too, and that's going to come up in a couple of slides. And I will discuss that in a moment. It's very important. But think about where you would like your staff members' eyes to be. You want them to be looking in the patient's eyes when they're asking for money, as they're asking for information, as they're greeting them. And think about this. If you're a specialty such as dermatology, you especially want your patients to look at your staff member because you often utilize staff members for procedures, etc., and you want them looking at a face. Eye-to-eye contact is a very bonding thing. I always love to see the receptionist eye-to-eye as I check in. A lot of times people are now going to taller chairs or standing receptionists so you can meet eye-to-eye. There's no looking up or down. It's also better for HIPAA. It can also hide a lot more documents, etc. And with everything still, our job is to anticipate every need every step of the way. And I know that a lot of front desk people see that. They see a patient walking in the door. They know exactly what to do. Think about when you want your patient to be reassured that you will provide the best care with compassion. Again, eye contact is essential for bonding and trust. And I don't give money to anyone unless they're looking me in the eye. It's just one of those things I don't do. Whether I'm in the coffee shop or I'm at the front desk, when they look me in the eye, that's when I respond. I was a ghost patient one place, and every single person that saw me in the hallway, anywhere, looked me in the eye and said hello. I felt like I was family by the time I left. It was absolutely wonderful. And it's just like manners. It costs nothing, and it pays greatly. It really does. Pays off incredibly. Scheduling is truly an art, and anyone who's done a schedule knows that. This can be a Pandora's box or a gold mine. When you ask a doctor or a provider how their schedule is going, usually they say it's okay, and then they start talking about, well, maybe on Tuesday afternoons I could do this, Thursday mornings I could have follow-ups, that kind of thing. And it's wonderful. Our systems allow us to really fine-tune it to each specific provider, but we cannot get so specific that we can only give a pap smear after 3 p.m. on a full moon on a Tuesday. And probably some of you are laughing right now because some providers are that specific. And we can't do that to the front desk. It's just not fair. Standardizing as much as possible. And I know you've heard this a million times, but let me support you in this. The fewer decisions the front desk has to make allows them to make a better decision and quicker and move on to the next task that you want them to be doing. Don't put barriers up to the care. Make it as accessible and fine-tuned as you can. Keep it simple and train well. And the already filtered decision-making really helps your employees with their workflow and much less frustrating. And then, of course, there are the phones. We all know about the phones. I was speaking with a practice in Georgia the other day where they had 5 lines coming in and 2 people to answer the phones. That's a setup for disaster. So you either work with a voice attendant that rings a certain amount of times, and if you can't get it by the 3rd ring, then it goes to voice attendant. You can channel it quicker. You can make it easier, things like that. But if you have not already, please have the first person to answer those phones not at check-in. They should be focusing on the patients in front of them. Of course, if they have the time, that's great to answer. But I would say to go to the back or one person at the front desk designated for that, not checking in. We all have our stories about answering lines while trying to check people in. And when we hire, one of the first things we listen for is their voice, right? And that's the same for patients. Listen for their phone voice. If they sound rushed, patients are going to hear that as well. And like I said, companies that will record your conversations can be used as a training tool too. If your front desk is aware they're being recorded, they're much more apt to try to remember everything instead of trying to scuff everything off and hopefully present better in those patients' eyes and ears. And again, scripts can be utilized here to help as well. Start with a script and make it your own so it's earnest and sincere. If everyone says the same thing in a different manner even, that helps as long as you're delivering the same message. It also might be a good time to look at your taking turns with roles at the front desk. Sometimes people fit, sometimes they don't. And even if you're planning on keeping staff members in a dedicated slot, you can see which post fits their demeanor best. The front desk is not for sissies, that's for sure. Now, this is where that statement comes in. We don't pay our receptionists to think. And this is what a physician, a medical director that I worked with, who was very good, very smart, but when he said that to me, I couldn't believe it. And he said it to me when we were alone in a meeting. And I said to him, I'm so glad you said that to me when we were alone, because I never want you to say that in public anywhere. Because as the patient walks in the door, we have to know their copay, we have to know their demographics, we have to be able to utilize the system. And like I said, when Angela said to me, I don't know if I'm doing anything right, I don't see the end result of what I'm doing. He doesn't see the end result. But as I reminded him, the end result is that he gets his paycheck because everything is done correctly from the get-go, and everybody contributes to that, especially the front desk. So unless you've worked it, you just don't know. And the front desk ends up getting everything because they think that you're just there checking patients in and not doing much else. Now, I think there's a little more empathy in recent times with all of the compliance issues and everything that has to be met, but that is practice-wide. It's with clinical and physicians as well, so everyone has to do that. But I think it's good to have empathy for everyone else's position. And then, of course, the front desk gets to ask for money. For the office to get a feel what it's like in other roles, I like role-playing at meetings. I like having the physician trying to read an insurance card and see where we should send the claim to. That alone can be confusing. Or when a patient walks in with a pile of papers and the front desk person is scanning those papers in as they're registering the patient, making sure all the information is correct while 20 people are in line behind that person. That's a real art, to make them feel welcome and people are moving along and they're being handled. That is not an easy thing to do, especially when somebody's not feeling well and they're standing there. Bring on the empathy, that's what I say. Now, the same physician that said to me, who do you see, we don't pay our receptionists to think, also gave me great advice that I still use with hiring. Sometimes we can really go with our instincts. Who do you really see sitting in that chair? You can change tasks. You can train people different things. You cannot change demeanor. Some people are great with patients. Some people are better in medical records. It's just a natural way that we all are. I am what I am, what I am. And as much as I try to change certain things, I'm still going to be a little stubborn, but I'm great at asking people for money. My friend Colleen may not be as good as that. She's a little less proactive. So use people, use your instincts, use the people that you think are best for that. And as we know, if we go things that are easy and more instinctually easy for us to do, they make better workers and a little happier in the seat that they're sitting in. I've hired people out of Shoney's breakfast buffets because they take that extra step and they give that extra customer service. It was just a matter of teaching the task. Healthcare is a very rewarding thing to do, and we can feel that too. We do not want the front desk to feel like they're the place for all the odd tasks to go because they're not perceived as busy. We all know they're very busy. Sometimes you get a break. Sometimes it's really busy, right? Collections at the front desk is absolutely huge. Copays, I think 35% of your patients now have high deductibles, so there's a lot more cash and a lot more things coming through. I think the average employee mandate now is about a $2,000 deductible, and Obamacare is about a $6,000 deductible. That means a lot of people and a lot of practices are essentially self-pay. So it's the transition of how much to ask for and how to get used to asking for the money is the big issue. So work with your billing department and set an amount that's really comfortable for the front desk to ask for. And this includes prior balances that, of course, would be confirmed, that kind of thing. But what is the front desk asking for from the patient at the time of check-in, or what should the billing department handle? Now, as I work across the country, I see more and more front desk staff being asked to ask for the total amount, and that could be hundreds or even thousands of dollars. And if the patient is aware of that and you present it appropriately, I think that's fine. Again, that depends upon your population, and especially if your front desk knows that you have got their back, which is what this is all about, then they are more apt to do it with confidence and maybe more apt to get it. Remember, the first time they walk into the front desk, it's usually the third time they're asked for money. The first time is when they place the appointment and they say, okay, Susan, we see here you have a certain insurance and this is your copay, and please be sure to bring in any copays or coinsurances due at the time. Then when the confirmation happens, that should be stated as well. So by the time I walk in the door, the front desk, that's the third time I should be aware of and being asked for my copayment. This should never be a surprise. Think of the high deductibles. Those can be met, and you can see way ahead of time if they're met, and define those limits and establish those boundaries. As we know, many times we are the resource for those patients to let them know how much money they owe. So we have to do it very quietly and privately, and usually not as a surprise at the front desk. Please do not do that. Here are your 6 primary emotions. Even if you could meet 2 of these during any encounter and address them, you're doing great with any individual. Now you notice, think of the front desk. Only one of these is actually easy to deal with. And clinical staff can deal with the not feeling well and the fear and the anger because they're trained for that clinically. We have to deal with that as well because they're walking in the door and we're the first ones to either calm the patient down or go the other way. We want them to feel good about being there while collecting their money. Not an easy thing to do. But if we can approach their fear and say, we're so glad you came in today, Dr. Childs is very happy to see you today. That addresses their fear because it reassures that we're going to take care of the patient. And hopefully, even if they're coming in for a wellness exam and they're feeling really good, there might be some fear that you're coming up with something that they didn't even anticipate. So even addressing these primary emotions, use your emotional intelligence to work with your patients and your staff members. It really works well. When you change anything, any kind of financial policies, any kind of staff members, if you're moving them around, make sure your checks and balances for financial matters are all in place. People start small. They start with copays. And it's just like dieting or losing weight or anything like that. Once I've had that little piece of cake and it tastes really good and nobody notices and I haven't gained weight, I'm going to have another, right? But if I know that there's checks and balances along the way, if I know there are cameras, if I know that I have to balance to the penny every day and account for it before I go home, and someone before me is doing their thing and someone after me is confirming what I've done and moving on to their step, that's the checks and balances you want in place. It's very easy to do. There are a lot of electronic options now, and it makes it much, much easier, excuse me, for me to do. For anyone to do with the electronic options. You have e-payments, you can pay online. A lot of your payers are paying electronically. It's much easier to do. The main thing is to keep the funds away from the person, the transaction separate from the money. And that's true with your front desk as well. And also, as an administrator, you have to protect yourself as well. Have your check and balance, and that's usually the medical director or another administrator or CEO or something like that. But make sure you have your checks and balances. I have many stories about this, and we have to all be very careful. And ahead of time, I say for patients, the best thing you can do for patients is, as I said before, not let it be a surprise. I was in one practice where the patient came up to the front desk, and the front desk person informed them that they had a previous balance and they could not be seen until paid, and it was a bad debt. Now, why didn't somebody call that poor patient ahead of time? He walked out in shame. The entire lobby heard it, and I guarantee you he told all his friends, and how humiliating. If somebody had just called him a few days before, and some patients will get a call one day before, but I say call 3 days to a week ahead so that they have time to get that money together if they don't have it on their own, or they have time to correlate pay or anything else. Let a patient keep their pride. Never put them in a place of shame. Forewarned is forearmed. And you're probably paying a fortune for your maintenance on your computer systems. Look for estimator tools. And if you use an estimator tool, be sure to use it so someone else can come in and see exactly what you've done. And if you want to use an estimator tool, also include a caveat that says this does not include any unanticipated visits and procedures that may be warranted upon the initial visit, and to please be sure to request and obtain a new quote if needed. So again, they're not surprised with that additional expense, because sometimes you can't tell everything that's going to be done. So you can forecast to the patient, give an estimate, and then meet with them afterwards. It's almost like good financial planning. If you make it easy for them, they will answer. If you make it challenging, they will shy away. That's the accessibility. And there has to be essential and clear communication to optimize the collections, and be as CPT specific as you can with these estimator tools. It helps everybody along the way. This is your new patient. Don't you love her? She's great. She has a high deductible of $6,000, and she's trying to save her money, but tomorrow she's going to break her arm and have to have surgery. So there are times when credit card on hold is absolutely wonderful. You could use credit card on hold for good, and I love that, or you can use it and take advantage and not to the best benefit of patients. So, for example, if you are using credit card on hold, it's fabulous for a predetermined surgery, for OB benefits, any kind of high cost or a high bill. I think it's great for paying off balances, and you pay it off in 2 or 3 or 4 months, whatever you can do, and it's predictable. And I would love to see these payments almost like a phone payment, where you know it's coming every month and it comes out, and you can separate the money from the care. It's great for estimates. It's great to take the fear away, and the patient can concentrate on getting better knowing this is being handled. The thing I like to avoid with credit card on hold is do not charge the credit card upon the initial EOB, because sometimes insurances make mistakes. And if they make a mistake and you automatically transfer it to the patient, that's not working on behalf of the patient, and that is our job. Our job is to work best on behalf of the patient, not for the insurance company, and sometimes they deny an error. And it's a good way to get the patient involved. The front desk can work with credit card on hold policies by confirming, I see, Susan, you're on credit card on hold for this balance. Today's copay will be this much. It's a great way to alleviate the front desk asking those difficult questions. It shows the support from the billing department, working with the patient, working with the front desk, and the patient knows that the entire practice is working with them and they are appreciative. That's a beautiful thing. If the patient is appreciative, they value the services and they're more apt to pay. And while we believe all of our billers might be working to our best advantage, sometimes they're sick and they just don't feel like dealing with it, and they'll go ahead and charge the credit card. I really don't want to do that. I want to give the patient time to respond. So if you do credit card on hold statements and you charge the patient automatically, Give at least 2 or 3 weeks. Allow the patient to respond, to become part of the appeal if it becomes necessary. It shows respect to the patient, or else you could end up with a whole bunch of credits. I also believe in really rewarding success. I think it's an absolutely beautiful thing. Only 5% of practices do this. And I say, show that initiative, throw some carrots out there. Why not? Dermatology has the highest percentage of doing this, and they make a lot of money. They do really well. And I think this works beautifully. Why not hold the carrot out for people? We get bonuses. Why not let them do it based upon time of service, especially year-end, things like that? And there is truth to the fact that, yes, they are being paid to do their job, and that's what they should be doing. But especially at the end of the year, you could show them time of service, or we have this many patients with 90-day plus balances. If we collect this many previous balances, we'll have a big pizza party. And everyone knows the more you collect, the more it makes the administrator look better. I was once doing a workshop, and I asked, what reports do you like the best? And one administrator actually wrote, the ones that make me look better. Let them make you look better. That's okay. They're happy. You're getting more money in. There's initiative. And you educate them. They're using reports, and they become competitive, and they want to do better. Staff members will show initiative if you give them a chance, instead of trying to pigeonhole them and keep them in a certain place. Utilize those system reports and use that success and show your entire practice how the front desk is helping. Recognition of the role gets claims paid. It really does. It's that simple. The billing department presence, as I said, is so huge, absolutely huge, and that's the core of this presentation. I've got your back. The front desk needs to know they're behind them and will support them whatever collections they need to do. And I hate to sound mushy, but it really is true. A team effort with everybody dedicated to supporting is not an easy job, but it works beautifully. I even recommend a continued presence by the billing department at the front desk. Once a week, twice a week, have somebody at the billing department there. They can answer questions. These are people that can do their job at a screen at the front desk. And if the front desk has a question, they come back and ask really quickly. The accessibility is the key. However you do that, if you can call upstairs or downstairs to the billing department and someone comes up right away, you don't need it. But if you feel like you need that presence to speak with patients about their bills, etc., again, every practice is different, so think of yours. But whatever that definition is, you have to have that level of definite confidence and dependent upon your office and how comfortable and confident you are. I would say payment arrangements always in a private room, we know that, or a private area. And what I found works best and most respectful for staff members as well as patients is anything over a certain amount or a certain age, including bad debts and collections, be handled only by billing staff. And again, it's a matter of pride and shame, and you know your practice. And a private setting. That's always so important. I love this picture because sometimes we feel like this. It's administrative versus clinical, right? Interdepartmental relationships. Who's really in charge of who? I was working in one place, and 3 employees that I interviewed didn't even know who to call in if they were sick. They didn't even know who to call about that. They didn't know who their boss was. Know who reports to who. If you are the person who's in charge and you are accessible and people don't know that, they're never going to come to you. We all have common denominators, and it's different offices and different specialties. But think of your office and clearly define who reports to leadership, who goes to physicians, and how they can't go to the doctor as an intermediary. You need to be the one, and that needs to be very clear to your staff who they go to with a problem and good things. But think about who does these things in your office, too, for the flow between the two, and this can be changed. Nothing is carved in stone. Anything can change as long as it works best for the practice. So who's handling callbacks, your follow-up appointments, patient registrations? Who does the authorizations and referrals? Sometimes it's front desk, sometimes it's clinical. Sometimes it depends upon specialty or the size of the office. Sometimes it depends upon who's there that day. We all know that we all work really hard to make this happen, but let's appreciate each post and what each person does. And to do that, we need to be aware of what each person does. This is what I call my kumbaya slide, because it really is a kumbaya thing. But this is when we're all supposed to take a deep breath. So when that person you report to has you covered in each department with each employee, we work much more confidently, without fear, and with initiative. We can really fly. We have pride. And this is not easy. Staff members need to know we will listen, or they will never approach us. Request input from your physicians, too, I would say. And in the office, you can maintain a balance and respect for all departments. We are the liaisons, right? The administrators are liaison. There might be one liaison from each department. That's not bad either. Again, depending upon your practice. But we all have to talk to each other. It's also the perfect opportunity to point out staff meetings. It doesn't matter how big or small your practice is. Everyone needs to have a voice, and everyone needs to be heard. Each person should have a voice. And they can't do it at the front desk while they're checking in patients. And the nurse can't have a voice while they're giving someone an injection. Everyone has the time. As administrators and managers, we often have time with the docs, but nurses alone and front desk alone does not. We have to give them the voice. We have to be able to look them in the eye and the face and say what issues are important so we can take care of them. That's why they call us support staff. And I mean this in the most positive way. For example, every general staff meeting, we'd have a couple of issues. We discuss them, give a 30-day proposal, then we come back at the next meeting and see how it works. Change is continual, as with progress and growth, and we can do that. One thing is interdepartmental relationships is issues tend to sit for a long time, and they're unaddressed, and they become a big part of the office gossip. A little office gossip is okay. It's like good stress and bad stress, but we end up addressing these issues eventually, and usually it's after a good person leaves, and then we have to approach it. Don't let the good ones go. Pull up your big girl panties and move on, and do it now. If we approach things and nip them in the bud, your good employees will respect you, and good employees can find a job anywhere. You want to keep them. If you're recognized for approaching as they occur and taking care of them and being a true leader, you will reduce large issues and take care of this, and I dare say you will reduce your turnover rate too. And this means you're an excellent administrator. Personnel issues are sometimes the hardest and also sometimes the most rewarding. So keep those continual conversations, trust, support, and bonding with staff. It pays off big time. As with the doctors, never, never discount the loyalty factor. One reason that medicine has a lower amount of fraud and embezzlement is actually because we are more loyal to our physicians. We believe in the care. It's a more personalized service. It's absolutely great. So rule number one of any collections in any office is the physicians are there to support you, and you can be loyal to them. They do not do payment arrangements. I used to have an agreement with Artie Axelbank. I didn't wear the gloves, and he didn't make the payment arrangements, and it worked out beautifully. It's very easy for the doctor to say, we don't really discuss billing issues, but I can refer you to Susan, and she would be happy to speak with you about that. And that way they know they're covered. How we speak with the patient about that is another process and point. We can talk about it, because I do not like going into the exam room to speak with the patient. But if it's a procedure that would be upcoming, they could meet with the billing department afterwards. Probably not the front desk, but you can see how the billing and front desk work together with pricing and any monies that may be due. The main thing with physicians is never discount the loyalty factor. If you are loyal to them, they will be loyal to you, hopefully. And physicians, if there are any physicians out there listening, never discount the loyalty factor from your staff. And be sure to say hi to the front desk staff, just like you do clinical. We are just as important. And we understand that physicians are clinically trained, so that's how the mind works. But remember, the front desk is the one that's setting your day. So please support us as well. With your interdepartmental relationships, another thing that affects it are your systems. Are you working around your systems? Are you looking at new systems? And I find when I'm looking for a new system, it's almost like looking for a new car. Do not take advantage and think that anything, a new system or an upgrade, is going to have what you already have. Remember the things that you like about what you already have. So when you check out anything new, you continue to get the same benefits. Another thing to say is that you are, again, paying a fortune for your systems. Call your vendor. Ask them what they can do for you that will not cost you any money or pennies, that will help you collect and do any other processes that makes it easier for your front desk in handling money. For example, if you can send out e-statements and it costs next to nothing and a patient can pay within 30 minutes, then that balance is not on there and the front desk does not have to even address it as they walk in the door, and the patient knows they're current. This is transparency. It's great communication. Having electronic options open that you can let your patients know about is absolutely huge. Time of services, run reports for your front desk, use your systems, see what you're paying for that you're not utilizing. I guarantee there's something out there that would be a great benefit for some of your staff that you're not using because you're so busy doing the day-to-day stuff. And have structured meeting with those agendas. Maybe meet with your vendors and see what they can do. It's just like an in-service. And they can even add issues before the meetings begin. And then you have it meet your workflow. Your workflow should not meet your system. Your system should meet your workflow. Your personnel manual is a beautiful thing. It's a great document. It's a legal document, and you have to clarify responsibility and accountability as you support the professionalism with all of your staff members, every single one. And it can make and break you, as you sometimes have to make important decisions. So let it work to your benefit. I think you have to be clear enough to offer the guidelines, but enough caveats to get out of it if you want to, right? So I can tell you that most personnel manuals I see are fine, just need to be updated and clarified from personal experiences, and make sure you have a professional look at it to be sure. And make sure each employee knows exactly what's expected of them. Now, the front desk, this would pertain to if you get caught stealing, it's an automatic termination. And this is what you are responsible for. This is what every staff member needs to read, their responsibilities, what they are accountable for, and who to, and that includes money. And, of course, we all know to have that sheet where they acknowledge that they have read and they understand the personnel manual, and any questions, they can come to you. Always have the page they can understand and sign and date. And we talked about emotional intelligence before. If you're doing any kind of testing, I think emotional intelligence is a beautiful thing to test for. It brings out empathy. It brings out instincts. It helps you see who might be better at collecting and who might sympathize a little bit too much. And I think that the personnel manual, again, is a great way to spell things out for each person with clarity and transparency. So now we think about our good employees. As I've said, your best employees look for progress, and if they don't see it with you, they're going to find it with someone else. That's the difference between a job and a career. So no screaming, don't squelch initiative. There needs to be access and venues continually available so they can voice their opinions and make the changes. The meetings we talked about, continual surveys are a good thing. Business successes and momentum tend to follow the pattern that we expect. We tend to go strong and then relax, and then we tend to regress because we become comfortable with that success. But we have to keep the momentum going. That's why we call it progress, right? And we have to keep it going, not feeling stifled. As always, it always comes back to you as the leaders, as the administrators. And one of the best bosses I ever had, Kay Stanley, said to me that her job was to make my job easy to do. Total support. That's what we need for the front desk from every staff member, just like everyone needs that. I would have done anything for her, and I still would. She was a wonderful woman. And this is what your entire practice should feel like. It's your time to shine and set the example of what we want our employees to be. And sometimes it's challenging to set that example, but again, that's what makes the difference between a job and a career. And what works better than anything else, I think, is sitting with each person that you supervise, spend 30 minutes with them at the front desk anywhere in their space, and ask them, what do you like, what don't you like, and what would you change? It's amazing the answers you'll get. The ones that say it will never get better, they're probably looking for a job, and maybe it's time you help them. But then there are people who say, well, if we just had this screen, go to this screen, or do this, I could cut through much quicker. Front desk has great ideas. Just ask them. And what an honor to be part of such administrators that would help set new standards of care that supports their workers. It's wonderful. Let's make them good ones. Here are some wonderful resources. There are no shortage. MGMA, of course, local, state, and national. Each one will serve you beautifully and totally with tons of resources for you. You have your local and state medical societies. Green Branch Publishing is absolutely wonderful. They have great webinars and great articles, great books. And I would say gathering information from all of these resources gives a very well-rounded practice that definitely collects well. And the last thing I would say for resources is look to your left and right. Your peers have tons of information. They know your practice. They're there with you every day, and that's how you will work together. And that is the end of my presentation. And if you have any questions, I guess this is the time.
Alrighty, if anyone has any questions, you can please type them in the question box on the right side. As of right now, we do not have any questions. So I will give a couple seconds to see if anyone wants to submit them now.
And I can also tell you that one of the questions I get asked most when I'm discussing this is credit card on hold policies and the front desk. And I would say that credit card on hold policies can be introduced many different ways, but not from the front desk. You can have printed information, and if someone wants to sign on to something like that, they can certainly introduce someone at the billing department so they can do that. But no big policy should ever be first introduced at the front desk.
All right, so we have some questions coming in. The first one is, what were the 3 things to ask the staff member when you sit with them one-on-one?
What do you like about your job? What do you not like about your job? And how would you change it? And how would you change it is the key, because it shows whether they're invested in making it better or they don't care and they're already looking for something else, because we want people to want to get better.
All right, the second question is, will this be available for replay? And that is a yes. I am going to post the recordings and email them out to everybody. And if you don't receive the email, you will also be able to find them on the members only tab on the state website. The next question is, how do you suggest when a one provider office and only one front desk staff?
So there's one front desk staff to do the check-in and check-out, I'm assuming. It sounds like it, if it's just one. That's a tough one. That's where you have to try to arrange things privately with someone, maybe over the phone at a different time. If there's only one person, you cannot be in 2 places at once. And if you are feeling very frustrated, I would go to the physician and ask even for a part-time person to cover the front desk while you could even make calls to patients ahead of time to make those arrangements. And the amount that you would pay someone part-time, I guarantee you the patients coming in the door, being forewarned and forearmed, will be more prepared to pay, and they will like that personal touch of you getting in touch with them ahead of time. But if it's just one person, the only thing you can do is do what you can and ask people to stand back if you're speaking with one person. But that's kind of a one-on-one question. If they want to email me separately, that's a tough one.
All right, the next question is, do you have any experience using Care Credit, pros and cons?
So Care Credit and other products like that are very good. And I don't promote one certain product, and anyone you work with should never promote one certain product. What anybody should want is what's best for your office. So I would say utilize MGMA listservs and ask what people are using. Ask your peers what they like best. There are several things out there. I've even gotten local banks to say, yes, we can offer loans to people that have good standing or something like that. I think the main thing is to offer options that people will agree to, as simple as writing a check or a credit card on hold.
The next question is, do you recommend partnering with a call center to assist overflow calls and help the front desk workflow?
I know people that really love working with call centers, especially with clinical, but the front desk is a harder thing to do because if they are totally trained to do what your practice needs and it sounds like they are calling your practice, then I say yes. But if you're at the point where you're using a call center and you have more than one office, you may want to consider centralizing appointments in one office or having dedicated staff for that. If you do not and you cannot do that, then yes, but as long as they're trained well and it doesn't feel like a call center to your patients. And to do that, again, I would speak with your peers and see, just like with care credit and other things, speak with your peers and see what services they have used that they like. And then I would definitely have a test patient check it out to see if it really works that way before you buy anything. Definitely check it.
How do you suggest we give constructive criticism annual reviews without offending them?
Well, that's a whole nother session. I try to offer a solution as I'm bringing out the problem, and I try to be as specific as I can to that situation so it does not become personal. So I would say, well, Susan, when you were speaking with that patient, you sounded very hurried and rushed, so that patient may have taken it that way when you said this. Or give what they could have said instead, and hopefully they will learn from it. It's never and always be told in private. It depends upon the situation, and it depends upon the person. But usually if you give an example with an answer and with a little empathy like, I know you've had a bad day, but we can't reflect that upon our patients, that kind of thing. And also helping them see from the patient's side what the patient may have heard, even though that was not the intention.
Do you have any recommendations for improving physician-administrative staff relationships?
Meet with them early and often. The more they know that what you do, the better they will appreciate you. And I can say that from experience. Dr. Axelbank and I used to meet once a week. We met Wednesday afternoons, and it was great because I could show them what I did. Now, with front desk staff and other staff, they don't have that time. So that's why the staff meetings are so important. And when you have a general staff meeting and physicians, or at least key physicians or representative physicians have to be there, that's their time to speak up. Even if people are frustrated in their role and they can't communicate well, if they feel like they've been heard, that's a big alleviation, and they can move on from there. What they do from there is different. They may decide, well, I've been heard, but they're not doing anything, and they leave, or I've been heard and we're making some changes. And that's the beauty of static meetings as well. And I used to put up an agenda with 2 or 3 things, and I would let the staff members put up the rest. What do you want to talk about? That's what I want to talk about, because that's the only time they can. And that's a really good way for Angela at the front to look in Dr. Axelbank's eyes and say, when you come up front and say this to me, it doesn't help our job, that kind of thing.
If a patient's name on the insurance card does not match their other identification, or they always say, I do not have my card with me, how do you handle this situation?
I always say when you're confirming the appointment, always say, please be sure to have your insurance ID cards, your most current one, with any co-pays or co-payments that are, or any high deductibles that are due, or else we may need to reschedule your appointment. I know a lot of people are coming in with pictures of their card, and certainly if something doesn't match, I would say to them, you know, we can't file this, and you have an agreement with an insurance company, with your insurance company, that you're going to give us your insurance information. But having that when you confirm the appointment, so they have been warned and they hear that message or it's texted to them, they cannot say they haven't been warned. And what you could do, if for example, I come in and I don't have my new card and something doesn't jive. If I were the manager, I would say, well, if you can wait and get the information and bring it to us, we will try to fit you in later, or else we would need to reschedule you. Now, this is the caveat with healthcare. If they're in the middle of a crisis, they may have to be seen, and that may be up to the doctor. But the more we train the patient to be ready, or they may need to reschedule or wait a longer time, I guarantee you they will have the information the next time, because they don't want to have to deal with that. They don't want to be there any more than they have to be.
How would you handle a front desk staff who gets easily overwhelmed?
First, I give them a hug, because I know it's so hard. It is so hard to work the front desk. Sometimes when you become overwhelmed, I would say the thing to do is think about, they call them anchors, and what kind of brings you back. Just like any other time in your life, when you become overwhelmed, you have to take a breath, stand back, take 5 seconds, and yes, 5 seconds is a long time at the front desk, but you take 5 seconds and you think about, what do I have to do now? What can I do later? What do the patients need me to do right now? And if you're feeling overwhelmed, you should always be able to go to a coworker or a boss and say, I am feeling overwhelmed. I recently worked with a manager who, she loved the management job, but it was so overwhelming because she was hit with so many questions. Well, at once, when she was coming in the door, she couldn't even walk in the door. And it's the same with the front desk. You're just being constantly barraged with all these questions. So if you can find a way to manage it, if you get some help from and support from your boss or your coworkers, or if someone gets overwhelmed because a patient is asking them too many things at once, a key word or a key phrase to say to patients is, I'm trying to help you. Let's handle one question at a time. And that way you're able to handle one question at a time. It sorts it out for them, and you can break it down, and you can take your time for them, and they know you're addressing what they need. But it also helps you sort it out and address things as you can in a little slower pace.
If a doctor ordering some lab works, would you advise the patients to check their benefits upon checkout? What would be a good protocol for these situations with third parties like labs, MRI, etc.?
So if they're ordering a lab and it's an outside lab, I'm taking it, yes. If I were the doctor, I would say, we are sending you to this location to do this. If you have any questions about your benefits, you can check with someone in our billing department, or you can call the number on the back of your insurance card. But they should never discuss the benefits, but you should say, please be sure to check anytime you're referring outside. You should definitely do that. And that is not handling the business end, but letting the patient know. And it used to be this way with the HMOs and everything. I used to tell patients, if you're walking in another door, make sure you have an authorization for that, even in the same building. So I think physicians can begin that conversation, but not handle it, but introduce the conversation and say, I see that we're sending you outside, and I'm not aware of your benefits, but if you need to speak with the business office or call your insurance, you may want to do that, something like that, to ensure that.
How do you go about helping your staff be better with their customer service?
Well, that's a really big question. I think, excuse me, I think if people feel good about being there, they'll be better with customer service. So if you can make your staff happy, then the patients are more apt to be happy. If your staff walks in the door and they're bitter, they're not going to give customer service. So if they're able to deliver customer service that comes from the way of support, that comes from the way of having the tools that they need and the screens that they need and the training that they need. I'm doing a customer service training in Georgia in about a month, and they have to be trained to know what to say. Just because you've worked at the bank doesn't mean you know how to handle a patient. And just because you've worked in a primary care doesn't mean that you know how to handle an oncology patient. We all have to be trained for the position we're in at the moment. So I would say have front desk meetings and talk about customer service very specifically, and use your best employees that give customer service, that give the best customer service, to train other employees. It also helps you escalate employees within your organization and let them move up.
All right, so that is it for the questions. Thank you so much, Susan, for we actually got one more.
Okay.
How do you encourage your staff to exercise discussions with patients to be accountable for paying?
Give them the script they need to make them feel that they're confident and comfortable in asking for the money. If you're comfortable in asking for it, that's the way you can do it. There was one patient that came in that nobody else was everybody was terrified of this woman. I was not. I knew her, and I just wasn't afraid of her, and I knew how to ask her for the money. But it's just feeling confident, knowing you've got somebody behind you, that if you have to ask for $3,000, I know Susan's in the back in case this person is going to give me a hard time. And I would say make it honest and sincere. Like, Susan, we know that you're aware of this previous balance. And I don't know if I'm addressing this question directly. Am I answering it?
I think you are.
Okay. You can ask me again. Maybe I can.
She said yes, thanks.
Okay, thank you. And I would say any follow-up to this or anything more specific, or if you're going crazy and your front desk is overwhelmed, you can always call me, and I can always talk you down from the ledge. I mean, I know it's hard, and sometimes the front desk is wonderful, and sometimes it seems like everything goes wrong, but I think people should be appreciated no matter what they're doing, and I love appreciating the front desk. I don't think they get enough of it.
All right, if there are no further questions, this presentation will be emailed to all participants and will be available on our website for web members only. If you have any additional questions, please feel free to reach out to Susan directly. And thank you, Susan, for putting on a great webinar today. We really appreciate it. Thank you, everybody, for attending, and have a great day.
Thank you.